Hey guys, I'm Dr. Jessica Finley.
And I'm Dr. Jeff Finley.
And this week we are going to talk about ear infections, also known as otitis media. When someone gets an ear infection, there are several symptoms associated with it, like fever, headache, irritability, listlessness, or feeling tired, which may lead to hearing impairments or other complications. Research shows that approximately 40% of children have ear infections before they reach the age of 5. The most common treatment for ear infections is antibiotic prescriptions. But have you ever heard that chiropractic may help? Let's take a look and see what the research has to say about chiropractic in ear infections.
Now, parents typically bring their kids in to see the chiropractor for many different reasons, but one of them is actually ear infections. Most parents want to avoid surgery, so they want to try alternative options like chiropractic and or even dietary changes to see if that helps. So when we look at what the research has to find, the purpose of these studies, of course, was to determine the effectiveness of chiropractic care on a patient with ear infections. Now, each case had a difference in frequency of care, meaning how often they came in for their adjustments. But typically, it seemed that the pattern emerged that they would start out at about 3 times a week for 1 week, then twice a week for 1 week, and then 1 time a week until the ear infection improved or resolved. Of course, an examination was performed on every patient, and most chiropractors found misalignments in the cervical spine or the neck area, and sometimes the mid-back and low back area. Each study had a different outcome, but all of them showed some kind of a positive outcome.
One study showed that 93% of all episodes improved, 75% of those within 10 days or less, 43 improved or resolved within 1 or 2 chiropractic adjustments. Another study noted that the patient was sleeping better throughout the night and had no more ear infections since starting care. Not to mention, the ear infection resolved Tylenol and antibiotic free. In a third study, the mother reported that her son complained of pain and fluid coming out of his ears, but she didn't see anything after looking in his ears. After the first visit, the patient responded very well, and the mother reported that the symptom of relief lasted longer than 1 day. She also noticed that his nose was running after the initial adjustment. In addition, the patient's mother reported that he was sleeping better and in a better mood following his chiropractic adjustments. After his first 2 visits, the patient's mother said that he stopped tugging on his ears and his nose stopped running. By the 3rd visit, his mother had canceled his surgery that had already been scheduled.
Wow. Now, as you may have heard me talk about before, we want to use research, especially high-level research, to guide our clinical decision makings for the best outcomes and, of course, for cost effectiveness. Now, it is true that most of these research articles that we're stating and using as reference are just case studies, which are considered lower on the spectrum of scientific validity. But, as I've also said before, we don't want to become evidence limited. Remember, it would be completely unethical to do a randomized controlled trial on children where one group receives treatment and the other one just gets a placebo treatment. Thus, we have to use the information that we have to help us, as well, of course, using our own clinical experience to help guide our protocols and treatments.
Now, this by no means is meant to say that chiropractic adjustments are used as treatment for ear infections. You should always have your child evaluated by a primary care doctor or a pediatrician. However, this is where co-management can be quite helpful. Allowing the chiropractor to evaluate misalignments and restrictions in the spine and fixing those has shown to help many children with ear infections. It is safe, non-invasive, and cost-effective, and it's certainly worth giving it a try.
So, as always, guys, thanks for tuning in, and we will talk to you guys next week.